COVID-19 Treatment Part 2. Monoclonal antibody therapy. What is it? Monoclonal antibody treatments are IV infusions that can help with the immune system recognize the virus and neutralize it. They are available to people ages 12 and older who have a mild or moderate case of COVID-19, if there is a high chance the illness could get worse. You may be able to get monoclonal antibodies if you test positive for COVID-19, your symptoms started less than 7 days ago, and you are not hospitalized. How do I get it? Monoclonal antibody treatment is only available after talking to your healthcare provider. You cannot receive monoclonal antibodies on your own. Monoclonal antibodies can be given into a vein by IV infusion. Antibodies may be administered only in healthcare settings or at infusion sites. Antiviral IV therapy. What is it? Another type of IV therapy called remdesivir is available to some people with COVID-19. Remdesivir is FDA approved for treating people who are at high risk for developing severe COVID-19. Remdesivir is also used to treat patients who are hospitalized with more severe illness due to COVID-19. If you are hospitalized due to COVID-19, your healthcare providers will decide if remdesivir or other treatments are needed. How do I get it? Remdesivir is only available after talking to your healthcare provider. You cannot receive remdesivir on your own. Remdesivir should be started as soon as possible, with outpatient treatment beginning within 7 days of symptoms developing. It's important for people at high risk to contact their healthcare provider if they have symptoms and test positive for COVID-19. The treatment is given as a series of 3 IV infusions, given once a day for 3 consecutive days. Cost and insurance. Talk to your healthcare provider or pharmacist if you have any questions about costs associated with receiving a particular treatment. The federal government has purchased supplies of COVID-19 pills, so patients do not need to pay for the cost of the medicine, although they may have to pay other charges. The federal government does not make remdesivir or some monoclonal antibody therapies available for free, so there may be a cost for those treatments. If you do not have health insurance or cannot afford the cost of a monoclonal antibody, you may be eligible for low or no cost treatment through a government program to supply doses to providers for free. For all treatments, clinics, or pharmacies may charge fees to patients or insurance companies, including service charges, dispensing fees, or copays. Talk to your healthcare provider or pharmacist if you have any questions about costs associated with receiving a particular treatment. Health insurance may cover most of these costs. Patients who do not have insurance may be able to find low or no cost treatment in their communities at a U.S. Health Resources and Services Administration, HRSA, health center or a community health center. Visit HRSA Health Center COVID-19 Therapeutics Program participates to find a center near you.